all round as well.
Yeah. So this will be an option for that.
Good afternoon, everyone, and thank you so much for joining us today for this LIDC webinar. My name is Shireen, and I work in the communications team here at the London International Development Centre. I will shortly be handing over to our moderator, Dr. Vera-Sanso, who's very kindly come along from Birkbeck on this cold winter's day to moderate this event for us. But before that, I just wanted to say a few words about this event. So for those of you who don't know very much about LIDC, we were formed in 2007 by a number of higher education institutions. And we currently have 9 higher education institutions as members. This includes the Royal Veterinary College, London School of Hygiene and Tropical Medicine, SOAS, City University, Queen Mary University, a number, 9. You can find out about them on our website, which I'm sure you're all familiar with because that's where you signed up for this event. We also have a number of NGO members, including Oxfam, WaterAid, and others. And what we do is we bring people together from across institutions, all their institutions, and across disciplines to work together on complex challenges in the global development sphere. I always feel I need to apologise for using the word development because I realise that it's very contested. It implies that there are a certain group of people who are basically privileged, who develop the others, who actually have normally been traditionally exploited and are therefore now underdeveloped. So personally, being of Sierra Leonean origin, I have very big qualms about using that term, so forgive me. But that gives you an idea of what we do, and until we come up with a better term, that's what we're going to have to use, I'm afraid. So what do? We do a number of events. In fact, where I decided that I wanted to work more with Penny was during a decolonising development workshop that we held a couple of years ago. And I will just say, now that she's here, I really appreciated her kindness in organising that event, because sometimes when you work with senior academics, we also publish a lot of information, we produce blogs, we have featured member sections, we're very active on social media at LIDC_UK, so please do link up with us. We provide training. We just had a big training course last week, in fact, on evaluation, which was our first hybrid training course. It went very well. We also help people in putting together grant proposals. We provide internship training. We also lead other projects that we have obtained funding for, such as our UKRI GCRF Action Against Stunting Hub. And on that, I want to say a huge thanks to my colleagues from the Stunting Hub, who have been very helpful today, particularly Dinesh and Caitlin. Thank you for all your help with setting up and organising this event. And the reason why we're having this one is because we had an event for Women's Day last year. And in that event, we had a speaker who had worked for a very big UN agency. And I won't say which one, but she was forced to retire when she got to the age of 60. Now, I would love to retire at 60. It's not, anyway, but she was forced to. We still have this thing where there's this tradition of making way for younger people, so that as you age, all your experience, knowledge is not appreciated. A lot of people, when they retire, still continue to work. You're expected to be able to provide everything from caring services to the school runs, and we all age all of the time. So age is quite unique. It's not like race or gender, those sort of fixed constructions. Aging happens to all of us. So we should be talking about it, especially as we're all living a lot longer now. I'm very grateful to our speakers. We are very privileged to have a speaker from the Poverty Action Lab, Ms. Mukerji, if I got your right name, sorry, a little bit nervous, and Ezibidi, who will talk to us about the research that they have conducted in South Asia and in West Africa. So we'll have two different perspectives. For those of you that are here, I think you know that there will be a Q&A, so there's time for discussion when the presenters have finished. Those of you online, please put your Q&A and suggestions in the Q&A section, and I will pass them on to our moderator. And that's it. I'll end by saying we encourage you to join LIDC. Again, you can find details on our website. And if you're joining us online, please live tweet. So with no further ado, it gives me very great pleasure to hand over to Dr. Penny Vera-Sanso. Penny, all yours.
Hello, everyone, and welcome to this event. I have to say, I am so glad we're having this. And the event on women's work is age development issue, and the answer is obviously going to be yes. So it's my job at this moment to introduce the speakers. Sorry, am I not visible? Yeah. Okay. So it's my job to introduce the speakers, and I have to say, the speakers we have, I now know. One was a PhD student of mine who's brilliant, absolutely brilliant, whose work I'm always citing. And the other is, who I'll introduce in a minute, is Shobhini Mukerji, who I have been on a panel with before and was totally struck by her professionalism and what she was having to say. And so I was really delighted that she could be with us today. So I'll just talk about Shobhini Mukerji. She's the CEO of India's Jameel Poverty Action Lab, and that is their largest office. And she works closely with policymakers, civil society partners, and research institutions to increase the use of evidence in policymaking and to scale up social programs in India and Asia. She is a passionate advocate for the use of evidence and data in decision-making and advises multilaterals and donors on policy interventions that have the potential to bring transformational changes to the lives of people living in poverty. She has co-authored large-scale randomized evaluations on foundational literacy interventions in India and in parts of Africa, reaching an amazing over 60 million children. So, Shobhini, would you like to start? Sure.
Thank you, Penny, for that introduction. I'm very happy to be here. It's great to finally meet you in person since that webinar that we did together. A little bit about where I work. The Poverty Action Lab is essentially a research organization that works across several regions, more than 7 regions across the world, looking at how do we influence poverty through data and evidence. So we do impact evaluations to understand what works or what doesn't in alleviating poverty. And we have a network of more than 500 professors across the world who are working with us. So what I'm going to be presenting today is the work by a group of researchers who work with the Poverty Action Lab in India, who've sort of done this really interesting work around aging. I'll come to it, but just to give you a sort of a preface in terms of why this is important for us and why we're looking into this, it's not surprising that there's a very large population currently, and it's going to increase in terms of people getting older, and the infrastructure that we have across the world needs to be able to adapt to the aging population. There are, we are aware of all the challenges that are associated with an aging population. So whether we're looking at intergenerational poverty, whether we're looking at the infrastructure, social security systems. We were just talking a little while ago about pensions and things like that. We're looking at health systems, participation in work, political participation across the spectrum. There's a whole care economy now. I think we are looking at women who are in the care economy who are now also looking after elders. So there's a lot of implications across the globe and across different sort of aspects in terms of why what is going to be the implications of an aging population. And we are now trying to work with governments to be able to what we're calling is bridge the gap to ensure that the elderly are their needs are being integrated into social policy, financial insurance, well-being. There's a whole group who's working across whether it's infrastructure, whether it's social policies, social protection, all of those things. So what I'm going to be presenting today is some work that has been done by a group of researchers in the state of Tamil Nadu in India. It's a panel data set which spans across right now 2.5 years, 2 waves of data that we've collected, understanding what the lives of the elderly are, what are their challenges that they face. The hope is that we are able to influence sort of government policy based upon the sort of the decisions, government decisions based upon the insights from this data. So just a quick brief, on the researchers who are working with us. We have Professor Esther Duflo and Professor Abhijit Banerjee who were at the MIT. We have a policymaker, Grija Vidyanathan, who was in the civil service in the state of Tamil Nadu. She retired as the chief secretary. She's one of the researchers as well. We've got Professor Frank Shilvak, who is at MIT. Assistant Professor Madeline McKelvey, who's at Dartmouth College, and Professor Garima Sharma, who's at MIT. So this is the group of researchers, and I'll be presenting some work that they've collaborated with the government of Tamil Nadu on, understanding what the challenges of the elderly are. So as I said, this is a panel data set, and we've, as part of the government, we are collaborating with the Department of Statistics and the Department of Public Health and Preventive Medicine to be able to collect this data. And why Tamil Nadu? This is something that the government actually, has been thinking deeply about. Is what are the old age pensions of the elderly? So Tamil Nadu is at the forefront of demographic shift. More than 22% population by 2051 will be above the age of 65. Now, this has a lot of different implications for states like Tamil Nadu, and there are several other better off states, more progressive states in India who are going to be at this demographic shift as well. So it's very important to be able to get enough information to be able to help the government design programs and policies. Please give me a sort of a 10-minute heads up or whatever when I have some time left. I could, continue speaking.
10 minutes already.
Thank you. So, what when we were discussing with the government of Tamil Nadu, it started off initially as sort of understanding what, how do we look at the old age pension, and how do we is there something that can be done with the old age pension? And when we did a census, and we realized that it's, there are many more eligible who are not getting the old age pension, but then there's a lot of other associated challenges with the elderly. So we collaborated with the government of Tamil Nadu to create what we are calling a longitudinal panel data set that collects information across various factors, and I'll just come to that, the indicators. And the idea is to be able to use this as a platform to build more innovative interventions on that could address some of the challenges that the elderly face. So we've got the data that has been collected, and this is the survey data that has been collected, is across a baseline and a first wave. So it's been about, I guess, 3 to 4 years across the 2 waves, and we are going to be continuing this for another 2 waves till 2026. So it's quite a long, sort of we're in it for a really long time. So as you can see, some of the indicators that we are collecting were across socioeconomic characteristics, financial status, access to government schemes, physical health, cognition, mental health. We also looked at social connections, and loneliness, depression, all of those things. So right now the sample consists of about 5,000 households as a part of the study that we're going to be following these households across a longer period of time, and these are across the districts, a few districts of Tamil Nadu. I'm going to give a very quick snapshot of what the baseline results said, and then I have a few graphs to compare what the baseline and midline, sort of the wave 1 looks like. And I'll be focusing a little bit on women as well. because one of the things that we are seeing that a large portion in this are women actually, in terms of the elderly living alone, as well as the elderly population that we have sampled in our survey. 24% of what we've seen is 24% of the elderly fall under the extreme poverty line, and 15% live alone. A large proportion of that is women. So you can imagine, what that means for us. And we've been looking at some of the health and indicators for the women as well. And it's not surprising that the elderly living alone are in poorer physical health, lonelier, and more depressed. What we also found was that only 16% at the baseline of the elderly were receiving the old age pension, which is 1,000 rupees per month, though many more are potentially eligible. So this was quite startling for us when we started out. By the first wave, this number has marginally improved. And then we found that at least 50% worked in the past weeks, and this was across whether it's in the farms, informal, part-time, other self-employed activities. Moving on to very quickly in terms of what we saw across the different indicators we had. Over 1/3 of the elderly were hypertensive of stage 2 or above, 60% stage 1 and above. So this is essentially not getting into the details, but there were serious medical health conditions, whether it's cognition, impairment, depression, loneliness for the elderly. And women were more likely to be more depressed, feeling lonely, and cognitively impaired across the spectrum across the range that we interviewed. And of course, I'll come to a few graphs in terms of the serious health conditions as well, and what the differences are between sort of the men and the women. The graph on the right essentially shows that the severity of any of these activities, difficulty of severity of any of the activities increases is higher for the elderly living alone, and increases from something as minor as getting dressed to climbing a flight of stairs, or walking long distances. So it becomes very significant, and it increases with age and with those living alone. So very quickly, I'll just talk a little bit about what the sample is. We as I mentioned, that the elderly women in the sample continue to remain higher. The urban-rural split, as you can see, we sampled about 64% of the elderly living in rural areas, 36% in urban areas. 26% of this the elderly live alone, and a large proportion of that are women. Okay, so quick, 3-4 slides in terms of what their status is. What we found was that a large proportion of the elderly are currently working, which was similar to what we saw in the baseline as well, between the baseline and wave 1. And baseline was done in 2019, wave 1 was done in 2022. So it's been a 2 to 3 year period between then. Across the different age groups, the share of the elderly working 80 plus was down to 27%, about from 50% in the baseline, and we found that 25% of the elderly receive old age pension, as I mentioned. Is a little bit of a marginal increase from the baseline. So we're looking into this as well. One of the most common reported issues was the lack of awareness on the application procedure here. In a snapshot, we found that the elderly living alone had worse indicators across economic status, but it was even worse for the elderly women living alone. Rural was worse than urban. So these are just very broad, was the highlights from what we looked at. Just a quick glance at this graph, across all of the different age groups between men and women, you see more women up to the age of 80, employed in work, marginally more than men. So you can see across 55 to 60, 61 to 70, 71 to 80. You will see a lot between baseline and wave 1. Elderly females working was slightly more higher than men. Physical health, as I mentioned earlier, so there's a bunch of tests that we did, and I think I can just take you through some of that. So we did in the physical tests, we did height, weight, and waist circumference. We looked for fitness. We did a tug test, endurance test. We looked at vitals such as BP, pulse, respiratory rate, SpO2. We looked at, on the ENT side, we did a clinical examination. So these are all of this was done by the health department. So they had people from the health department and the Department of Statistics in the government who collaborated to collect this data. So it was not our survey teams, it was the government's teams who were collecting all this information. And then we looked at hemoglobin, we looked at, C-reactive protein and things like that. So across all of these indicators, we find that, there was, more hypertension, more, so increased prevalence for every age category from baseline to wave 1. And for hypertension and diabetes, urban was higher than rural in these cases. Women, higher compared to men across all these indicators. What we found was, interestingly, that there was a large gap between what was self-report, like the self-awareness of the elderly across some of these chronic conditions. So there was very low awareness for them to even go and get themselves tested or go to a primary healthcare center to test for any of these measures. So the gap was highest we saw for hypertension, but in general, just a very large gap in what the self-awareness of these diseases for the elderly. And that also has an effect on screening, on detection, early detection, and all of that. Women have higher deficiency, the higher anemia. So this is, this is a busy graph, busy slide with many bars, but just, the bottom line here was that the elderly women and urban areas have higher prevalence across several NCDs. So whether you look at diabetes, hypertension, anemia, and women were more likely to be, affected than men. Mental health and social connections. So here, essentially, we looked at a bunch of different things. So as I had mentioned earlier, we looked at loneliness across different scales. We looked at cognitive status, depression, and then self-reported interaction. So we found that 60% elderly are cognitively impaired. More women, 41% elderly are depressed, and more women are depressed than men. More women are more impaired than men. Again, this increases between baseline to wave 1 across almost every category. And we do believe that COVID did have something to do with this because, these elderly were in their homes. They weren't able to have that social interaction. I'm going to skip this, but these are just some slides to show exactly what I've been saying in terms of, moderate and severe depression increased between baseline to wave 1, and it was higher for women than for men. It increased cognitive impairment, again, increases with age. Women are worse off. All of these graphs show exactly that across the age and spectrum. And I have about a minute left, so I'd like to focus on what we want to do going ahead. We as originally envisioned, we have 2 more rounds of data collection that we want to do up till 2026. And we are hoping that, we can use this as a basis for sort of doing a bunch of different interventions. So just to give you a quick snapshot, we've been talking to the researchers and the government, the 2-3 implications of this. I might have something here. And just to mention that this is the departments who've collected all this data, and we've been supporting them on the data collections. So it's been even a capacity building exercise for the government to be able to, and the government workers to be able to collect, very scientific data on a very large scale. So just to end here to say that there is a senior citizen policy, and the focus there has been on health and nutrition, on social security schemes, livelihood, income and housing, on institutional care. So we are looking at how can, what are the implications into the senior citizen policy, looking at modifying the old age pension. And lastly, we want this to be a platform for further intervention. So so we're looking at the impact of the government schemes on the elderly in terms of the reach and the uptake and the impact. There is a machine learning that we're looking at for health screening so that we can at the doorstep, which is cheaper and faster and can have some early detection. And lastly, I think just looking at cognitive behavior therapy for the elderly women. So these are some of the interventions that we are looking at in collaboration with the government. That's it from me. Thank you.
Thank you.
Thank you very much. That was rushed, but very interesting. Lots in there. I'm sure we'll have lots of questions that people want to come back to you on. So now I need to introduce Ezzy. and this is a great pleasure. I am going to say that Ezzy was a student of mine, and it's absolutely wonderful to be on a panel with her. And her work, I feel, is unique, and I cite it all the time. Almost every paper I cite it. So yes, great pleasure to introduce her. Ezzy is a coordinator of Brilliant Parents and is a director of Beyond Mentors Community Care Initiatives. She co-founded and is a vice president of Women's Community in Africa. She has worked in the areas of social policy on education, aging, and gender. She actually has a huge background, but I'll take more than my allotted time to introduce her. And has undertaken a wide range of consultancy roles in Nigeria and the UK. So Ezzy, please.
Sorry. I can do it. Perfect. Yep. A little more.
Yep. Well, good afternoon, everyone. Thanks, Penny. You're not biased at all. Well, I just want to share my research that I did for my doctorate. And thank you, Sharon. When you reached out, I thought, yeah, somebody wants to hear it. And so I'm just going to quickly go through my findings and all of that. So here we go. Well, why did the research aim and objectives? I was just trying to find out what are the factors that could determine the adequacy of pension of civil servants, women civil servants in Nigeria. Yeah, I didn't tell them the title. Could you go back a bit? I'm aware of the time, that's why. Well, the title is Adequacy of Pension Income in Nigeria, the Case of Retired Women Civil Servants. Yeah, so just what are the likely potential factors that will impact the pension income for them? That was the whole thing. And for me to be able to answer this question, I had to break it down into 5 specific objectives. And the first one was to determine the pension entitlement. What is there? How much are they even entitled to? And the second one is to determine the retirement expenditure. So this is how much they get. What do they spend it on? Because I know that will be part of the factors that will determine whether it's adequate or not. And the third one is to determine if there are other sources of any other source of supplementary income for them. And the fourth one is to evaluate the impact of the life course on retirement outcomes. That includes on the entitlement, on accessing it, all of it. Is there anything that the life course has to, any impact it has on that? And then the last one, interesting one. This one was because there's this notion that, pension tends to assume full-time, formal, lifelong employment as the norm. And because of that, it kind of brings in inequality. So I thought, is there a way that Nigerian pension system is gendered? So these are the things that the objectives I was trying to get to so I can answer the question that I asked. Well, go on then. So my method, it was the primary data was collected, just structured, semi-structured interviews and questionnaires were used. And the sample, small sample, I had 95 retired civil servants, aged between 52 to 67. And then 10 key informants, then the secondary data, pension policy, the PENCOM annual reports. Yeah. So to be able to really, truly understand these women's retirement experience, I just had to adapt 2 approaches. The first one was a gendered life course. And I did that because I wanted to find out how their experience, their journey of their life, including the history, the social thing, the history in Nigeria, all of that, how does that impact on their retirement experience? And also, I had to use another approach of a gendered political economy approach. And this was simply to debunk all of this unitary household notion, the myth, and then to enable me to adapt Razan's care diamond. That was why I had to use that approach. Simply just to illustrate the multiplicity of sites and institutions that is involved in social care, social provision or care provisioning. Yeah, so this is how I went about it. Now, to analyze this, I then decided to do my findings, summarize them under 3 themes. And then the 4th one was to kind of do a summary of the whole factor. So the first theme was gender, pension, and the life course. So I'm just going to, because of time, I'm just going to go look at each one, each of the theme, and then look at a few main findings that are relevant to what we're talking about today. So go ahead. So the second theme is the role of reliable basic services and infrastructure in adequate income in retirement. And the third theme is the role of pension supplements in guaranteeing adequate retirement income. Bear in mind, that was my aim. How adequate is their retirement income? That's what I was after. And then the last one is a summary of all these factors. So I'm gonna then look at the findings in each one, if that's okay. Yeah, that's fine, let's go. So the first one, under the gender, pension, and life course, the first finding was that there's a low pension coverage, especially for women. And this is purely because they are overrepresented in the informal sector, because I'm looking at pension in the formal sector. So there is that low coverage for them. And this creates some sort of a very marked gender inequality in pensions already. So the next one, please. So the assumption that people in the formal sector do not have to worry about pension is so misleading, because they do. They do, because there's so much inequality, and also the entitlement would depend on the acquisition of the pension itself. So if there's this thing that if you're in formal sector, you're okay with pension, you don't need to worry about it. But my finding shows that they still worry about it because it's not, well, it's not enough. Yeah, so, and this is because the disadvantages of life course in acquiring pension, in getting into the job and getting the pension, that comes to bear in the pension entitlement as well. So the next one on that, no, I'm still on that, sorry. The gendered life course greatly impacted their education, their access to pension, and also the pension amount that they got because of that. Yeah, the next one, sorry. Sorry, forgive me, I'm just trying to get through my time. So the next one is the role of reliable basic services and infrastructure in how much adequate their pension is. And one of the salient findings in this particular theme is that though constitutionally the state is supposed to be responsible for social provisioning, but since the days of SAP, he has relegated this to the market and the other nodes of the care diamond. And because of that, most of these retirees that I worked with, my participants, due to their linked life with their children, their grandchildren, they come to, and they assume a truism that women always take care of their family. Then older women, I found that the older women, they have a significant place in the care diamond of Nigeria, given that the minimal role of the state and the dominant role of the market. So this is what they do. It's like they've taken on the role of government in social provisioning. And because of them there's this dominance of an unregulated and unmonitored market in the provision of healthcare and education. And because of that has led to a higher cost of accessing these services. And the consequence of this is that the family plays a significant role in accessing these services through the market. And to do that, many rely on extended family. Women retirees, they prioritize the educational and healthcare needs of their own family over and above their own. And this negates the whole point of pension. One of the main goals of pension is that it is enough for them to look after themselves in old age. But with them spending it on their children and their grandchildren, it doesn't. And the next finding on this particular theme is that limited access to reliable basic services kind of impacts the degree that pension is adequate for them, because they have to pay for all of the health, the education, do your own water, get your own generator, all of that has to be, they spend money on all of this. And it is difficult for them to maintain their consumption pattern. And then there's the possibility of pensioner poverty in that. Yeah. Okay, you see why I'm rushing. And then the last one is the role of pension supplements. Okay. The role of pension supplement in guaranteeing adequate income. Because of all that they had to use their pension money for, the first thing that we found out about this is that a lot of them use a combination of supplements, agriculture or non-agriculture. Some are trading. These are civil servants who have retired to go and rest, but they have to get to make some ends meet somehow. And so it shows that the pension supplement plays a very key role. It plays a very key role in ensuring adequate income for them to maintain, because it's about maintaining your consumption pattern. You don't retire and then go below, but that's what happens these days. And then also to prevent pensioner poverty. But spending it on somebody else, now he's going faster. Yeah, okay. So then the next one is that in this, you see, there's this belief, and wrongly, that children are socialized. Well, in Nigeria, children are socialized to care and protect their parents in old age. But my findings is against that. My findings shows that the role of filial support in augmenting pension is minimal, it's erratic, it's unreliable, and this is because of the under and unemployment that is going on. How do you take care of your parents when you don't even have a job? You've graduated for 6 years and you don't have a job. So that was one of the findings. And I find that 72% of the women, they don't rely on their children at all. If anything, they're the ones spending on their children. So this particular finding negates all of that notion. It calls into question that assumption of uniform old age dependency. Everybody thinks, oh, the old depend on their children. They don't. The next one. The next finding on this particular one is that the informal sector is the main economic safety net for Nigerians. Because you see all the people who have worked in the formal sector coming into the informal sector because their money is not enough. The next one, please, quickly. Sorry, Penny. And these are the factors. I just round up all the factors that determine that impacts pension income. On the left-hand side here, I know, Penny.
No, you've got 2 minutes.
Yeah, I have 2 minutes. Oh boy. Anyway, so I'm going to leave that. So on the left, the only positive factor that impacts it positively is the supplement. These other ones, negative. Go on then. I have 2 minutes. I need to write it. So what are my conclusions? The first conclusion is that the retirement regulations in the Nigerian civil service disadvantages women. How does it do that? Because the retirement requirement is 35 years of service or 60 years old. And then women who entered on a low level at 18, by 52, they have retired. And then another conclusion is that pension outcomes in Nigeria it reflects that long-term gender inequalities, enduring cross-generational family interdependencies, and they need to take up work in the informal sector to supplement poor formal sector pensions and to compensate for inadequate social provision. And another conclusion is that in light of the context, the normative expectation of extended family structure, that's how our lives age, just linked lives, high rates of under and unemployment of dependents, and of course, limited and high cost of access to social provisioning. Pension is and will always be inadequate in Nigeria. And then the last conclusion is that the sustainable provision of formal sector pensions should not be the end of policy concerns about well-being in later life, but the start of a much wider focus on social provision and social relations in later life. And so what recommendation did I draw from all this? The recommendations, I realized that my findings, my study have implications for three policies: the pension, the aging, and the social policies in Nigeria, social protection policies in Nigeria. So for pension policy, my recommendation was that they extend the retirement age to at least 65. And then to address the inherent gender bias that is in pension policy. Because Nigeria believes there is no gender in their pension policy, but there is. And so that's my recommendation. If one or two states have already, not that they saw my research, but they've already extended their retirement age, the next one, please. Also to develop reliable basic services and infrastructure. If they can do that, then perhaps the pension will begin to be sufficient, be adequate for the retirees. For aging policy, there has to be a nuanced understanding of later life by assessing older people's needs, obligations, and abilities. We need to know. There has to be that. And also some sort of research center for aging in Nigeria that will focus on advocating for the needs of older people and works in partnership with expertise from academia, health professions, everyone. Yeah. So for social protection, interesting, you talked about social protection. You called it old age pension. So for social protection, I think there's a need for a broader social protection policy to mitigate old age, not just the old age, but social protection policy. Nigeria really doesn't have one. And the last one for this, thank you, Danish. Social pensions for those age 65 plus. It was interesting when I went for my research because I found that 2 states in the country are already doing this. And I thought if 2 states can afford to do this, then the country should be able to do this. And then I used help age, some calculation, something that they use for social pension. And then I found that if Nigeria begins to give social pension for people aged 65 plus, it will only cost them 1% of their GDP. So I think age is truly a development issue and it needs to be addressed. Thank you, ladies and gentlemen.
Right, thank you very much. So can we tip this back a bit? Yeah, there we go. Do we have any questions?
Yes. So there is actually 2 things I contribute before you go to the question, because I didn't forget. It's just picking up on the presentation by Ezzy. Concerns about how elderly people are socially treated in West Africa. As I mentioned before, I'm from Sierra Leone, and the last time I was home, I visited our only mental institution, and I met there a lot of elderly people who didn't seem fine. You know, I spoke to them and sat with them, and with a lot of them, and this was confirmed by the hospital staff, they said that they had actually just been dumped at the mental hospital by their families because they couldn't afford to look after them. And I just wondered if that was a phenomenon that happened in other parts of the world. I know that in other parts of Africa, I'm not so sure about India, but or anywhere else, but I know that in other parts of Africa, some elderly people are actually labelled as being witches, sometimes by family members if they're vulnerable and lonely and unsupported, basically so that their land and property can be seized and that they can be, you know, dispensed with, if you like. So given that, and given what both you and Shobhini have said today, and given that age affects us all, what can we do to put this on the global development agenda? Because everybody now talks about climate change, which affects us all, but so does age and aging. So what can we actually do to, and that's up a question that we've had in the chat. So
Okay, I'll let Penny take that first.
Right. Okay, so two things, I suppose, two responses. I think one has to be careful in terms of work on aging, of the outliers being seen as though they're the central issue, where actually, you know, aging poverty is important across everybody, not just those who get caught in these attempts to strip them of their resources. So that, you know, we have to look at the whole thing rather than necessarily the sort of smaller percentages, and not direct policy around those smaller groups, although catering to them is important. And the other thing is the decade of healthy aging, which is being set up for the next 10 years, which is around supporting the SDGs, is entirely about putting older people on the agenda, as well as, you know, aging across the life course, which you've mentioned earlier as you know, the way we should be looking at it. So it's going to be bigger. And I think, you know, I might be stepping out of line here, but I think Tamil Nadu, the state of Tamil Nadu, which Shobhini was working on, has always been good on social protection. And this is one of the things why it's come up now. This, you know, the decade started last year, and people are pushing forward on this. And it's part of the SDGs. So, and the SDGs includes older people and everything now, because it's a leave nobody behind policy. So I think we'll see more of this. Do you have another question in the chat?
no, you actually covered it about, because it's about what can we do.
Oh, okay. Is there any other question in the chat for individuals?
Does anyone in the room have one? Oh, great.
Mine was for you, just about, so I was gonna ask about the editorial kind of required ages, but you answered that. So I guess, were you seeing, were the women who were entering the informal economy after ending their career in civil service, had they been kind of involved in the informal economy throughout their careers in the civil service, or was this something where they ended a career in the formal economy and then had to forge a path for themselves within the informal sector afterwards, like a new kind of a second career, a new kind of economically?
Yes, it's the second one. They were, because when you are a civil servant, you don't have time for anything else. That's your job. So my finding is that they went into the informal sector because they have to supplement what's their income, their pension income. So it wasn't as if they were doing the two at the same time. No, they just had to do something. They realized, listen, I still need to maintain my consumption pattern, and I can't based on what I'm being paid. So I need to do something. And it's interesting because majority of them are into farming, some sort of farming, fishery, piggery, which other one was the common one? Fishery was the commonest one. Just anything. Some of them just at the backyard. Just set up something at the backyard. For those who are into sewing, it's just a shop in front of their house. Those who are selling, the same thing, just something. So it wasn't something that was planned. They just found themselves. One of the things I got involved in Nigeria was doing retirement training for the people like this. So they can plan ahead of time. You say, if you know because you kind of live it, you don't think about it. Penny, when are you retiring? Do you know?
What was that?
When are you retiring?
2 years from now.
Oh, you know, some people just don't think about it. They just leave it there, the back burner, and then all of a sudden it's 1 year away. And so I was doing training on that to train people to say, be ready for this. Think about what you're going to do after you have retired. It's not even just about the income. It's also about staying active, because I'm talking about women who are retiring at 52. They have to do something. Some people are going into a job at 52, but they are retiring at that time. So that was one of the things I was involved in, training, pre-retirement training, I called it. Yeah, thank you.
I have, are there any more questions? Because I have a question. Oh, okay.
Sure, I have a quick question. This
Okay.
is regarding the diversity. Now, this data comes from Tamil Nadu, which actually, I believe personally, has a little better social net protection for the citizens. And Tamil Nadu has also had historically lower fertility rates. Now, if you look at the north, what would be your prediction for the north? And second, is there a national policy coming soon for elderly protection in India? Because India's fertility rate has dropped beyond 2.1, which is something very significant. So we are moving towards the other countries now. Thanks. Sorry, I mean, the microphone stopped, but that's working. Okay.
So I think just to answer your question, there is a lot of variation in terms of the kinds of social security that each state provides. And Tamil Nadu, so you will be surprised that it's one of the lower, for instance, or say average, median average social security that they provide through the old age pension. So you're absolutely right. I don't think, we do have a Government of India sort of guidelines around social protection and the old age pension in particular. Social protection, of course, takes many forms, whether you look at basic income and all of those things. But for the elderly in particular, each state has its own sort of benchmark. States like Andhra Pradesh, for instance, have anything between 2,000 and 4,000 rupees per month, which is double of that of Tamil Nadu. So while Tamil Nadu is progressive, southern states actually are on this. All of them are on this spectrum as well. And in the northern states, we do see a decline in fertility. It's not yet as sharp as what we're seeing in the southern states. I think it's just your STS indicators and how progressive they are. So I feel that there's a lot right now. There are some institutions that are trying to do a lot of, I would say, lobbying with the government in terms of how they can improve the social protection scheme, especially for the elderly. I just think we have a very long way to go. There is an emerging, and again, because of the elderly population, because of an aging population, and because of populations that now have more access to, slightly, I would say the median income has increased. We are seeing a lot of comorbidities. We are seeing a lot of hypertension, NCDs, basically, hypertension, diabetes, all of those things. And Tamil Nadu, again, we are seeing a lot more of that. So there is a compounded problem. So it's not just the social security system or the old age pension that needs to be taken care of. We have to also start looking at some of the health insurance that goes with it. So, what are the things? Many of these, for instance, are not there in the government health insurance schemes. So it's a lot of higher out-of-pocket expenses. So it's almost like cascading effect and a spillover effect rather, in terms of how do you reform the health system, insurance systems, for instance, and reduce out-of-pocket expenditure for all of these different age groups. So I haven't fully answered your question, but I'm hoping that it throws a little bit of light on how large the challenge is.
Can you stay there and let me ask you a question? Well, it's not a question. I've asked you to do something. We had a conversation about the kinds of policies that are operating in Tamil Nadu, which ends up with exclusions. And then you had a suggestion about another way of doing it to counteract that. And I think that's something that would be useful for people to do.
Yeah. So I think one of the insights from the understanding why so few eligible people were getting the old age pension was essentially that it's right now there's a very high exclusion errors. And then, of course, there are data system errors as well. So all of those notwithstanding, but in the exclusion errors, essentially, the fact that you are having to take, say, 5 steps to say you are eligible for this because of 1, 2, 3. What we are, again, this is not yet a policy, but what we are recommending is that there's another way to counter this is to say, make everybody by default is included in the old age pension, unless you are 1, 2, 3. In a sense, then you are just expanding your net wider to say many more people all of this population is eligible. Everyone is eligible by default, unless you have a private pension already, income bracket, all of those things. So then that's another way of looking at being able to, I would say, expand the net to reduce the exclusion errors. But it's not yet a policy. It's something that's being recommended right now.
Right. So, sorry. I think at this stage, it's time for me to just bring out a couple of things that I wanted to, and bring this to a close. And the main thing I think that comes out of this is the fact that actually you can't look at old age poverty just in terms of pensions, that it's the larger context in which people are involved, that you need to look in terms of linked lives, because it's the poverty of other people that older people are correcting, and it prevents younger people helping out older people. So it's not a small local focused piece of work that you can do on this. The other thing is that I think that's really important is that is to be aware of what you think pensions are and actually dig underneath, because you find that they're not. So in India, they say they have a universal pension. It's not universal. It's for the poor that meets certain criteria. So it's not a universal pension. So, and then the idea that, pension is accessible to everybody. Well, it's not. You have to look under it. And if you have a pension criteria which says you don't work, but you work sporadically, how does that fit, right? So there is so much digging under to find out what is going on and to understand older poverty by actually looking at the relationships, the life course which we've seen, but the idea of a sort of linked lives, life course approach, a gendered linked lives, life course approach. There's nothing simple about it. It's very expansive, and that's actually what you need to do. So you need to, if you're looking at this, you need to actually interrogate your understanding of what you think is actually going on, and then finding out if it really is. Okay, so I want to thank everybody now. I've really enjoyed this. It's been wonderful. I hope you've learned a lot. I always learn a lot. I want to thank Shireen for organizing it, and for the people that have helped out, and for our 2 speakers. Thank you very much. And for your attendance, Thank you. Bye.